Hi. Today we're going to be talking about the digestive system on anatomically correct models. Here to start you off is Allie.
Okay, so first thing we're going to talk about the oral cavity. And the top of the roof of the mouth is known as the hard palate, which is this area here. And then towards the back of the mouth is the soft palate. It also contains the uvula, which closes off the nasopharynx here. The next is the tongue. In the top of the tongue is the dorsum, and below the tongue is a small tissue which is called the lingual frenulum, and it limits the movement of the tongue. The next thing is the salivary glands, which produce amylase that breaks down starch into glucose monomers. This gland is the parotid gland, which is found by the back of the ear. This is the sublingual gland, which is found under the tongue. And this is a submandibular gland, which is found under the mandible. So the next thing we're going to talk about is the teeth, which some anatomy of the teeth. This area is known as the crown, which has enamel located in it. This blue area contains dentin. And this area of the tooth that pinches off is known as the neck. This area that contains the root of the tooth is known as the cementum pulp cavity, which contains the blood vessels and nerves. This area where the nerves and blood vessels travel is called the root canal. And then the area that the root protrudes into the mouth is called the gingiva, or known as the gums. So for the teeth, the dental formula is 2, 1, 2, 3, which includes 2 incisors, which if you cut it down the middle, you start directly this way. 2 incisors, 1 canine, 2 premolars, and 3 molars. And the incisors are for biting, the 1 canine is for tearing, the premolars and the molars are for grinding. Okay, and there's also adult teeth are known as secondary teeth, and baby teeth are also known as deciduous teeth, which means they don't stay in the mouth. So next we move to the esophagus. This area here that runs through the diaphragm, and also on this model over here, is known as the esophageal hiatus. And back over to here, where the esophagus feeds into the stomach, is known as the esophageal sphincter. And this first part of the stomach is known as the cardia. In the top,
I need to get public relations over here to get a picture of this.
the top of the stomach, this area here, is known as the fundus. This large curve here is the greater curvature, which also the greater momentum connects to this and is also known as the beer belly. And it covers the large intestine and is also used for wound isolation so that the infection stays within the omentum and doesn't go to the internal organs. And this is the lesser curvature, which includes the lesser omentum that covers these supporting organs. Okay, so this part of the stomach is known as the body, this middle section, and the little folds inside the stomach are rugae, which are used for the expansion of the stomach during digestion. This bottom portion of the stomach is the pylorus, and this area here that connects the stomach to the duodenum is the pyloric sphincter. And Shannon's going to continue with the rest of the intestines.
Hi, so we're going to take a break from the alimentary canal, which is from your mouth to your anus, and we're going to talk a little bit about the accessory organs. So the liver, pancreas, and gallbladder are some of your accessory organs that help aid in digestion. So the liver has 2 lobes. It has a right lobe, which is this half, and a left lobe. Well, 2 lobes that you can see on this model. And they're separated by the falciform ligament here. So now your gallbladder, which is shown in green on our models, and everything pertaining to the gallbladder is also shown in green. So it's going to end in this duct right here, and this is called the cystic duct. And then the 2 ducts here, which are, you can see, connected to the liver. So hepatic means like pertaining to the liver. So this is going to be your right hepatic duct and your left hepatic duct. Where these two ducts merge is going to be your common hepatic duct, and where the common hepatic duct and the cystic duct merge is going to be your common bile duct, which you can see is also continuing here. And that's going to empty out into the duodenum of the small intestine. So the pancreas also has a duct. This is the pancreatic duct, where pancreatic juices, which contain enzymes to aid in digestion, are also going to flow into the duodenum. So the bile that the liver secretes is going to be stored in the gallbladder, which is going to go through this duct system and empty out in the duodenum. So whether the liver is secreting it or it's being emptied out from the gallbladder. So the small intestine is going to start right after the pyloric sphincter. It's going to begin with the duodenum. Now the small intestine is so named because it is 1/2 the diameter of the large intestine, not because it's shorter. So the duodenum, where all of these digestive juices are being mixed into the chyme from the stomach, that's going to start off the small intestine. Whoop, just take that out. And that's going to turn into the jejunum of the small intestine, which is all of this here, which is where the majority of the nutrient absorption is going to happen because of all the villi and microvilli in the jejunum, which are gonna give it a huge surface area to absorb things. So the small intestine is going to end in the ileum, which is where a lot of major vitamins like K and things are absorbed, vitamin D. So the ileum is going to turn into the large intestine or colon via the ileocecal valve, which is right here. And the colon is going to begin with the cecum, which the end of the cecum is going to culminate in the variform appendix. So the colon is going to come from the ascending colon. We'll just put this back. And then it's going to go into the transverse colon, which is in the transverse plane of the body. And then it's going to end in the descending colon. And this right here is the sigmoid colon, but you can see it a little bit better on this model. So the sigmoid colon is this nice S-shaped here, and that's easy to remember because sigmoid begins with S, so the S curve is the sigmoid colon, and that's the end of the large intestine. So then you're going to go this muscular portion here with the muscle around it. This is your rectum. So you have your internal anal sphincter and your external anal sphincter, and that is, so your alimentary canal is this. And then going back to the colon, you have two flexures. You have your right colic flexure, which is also known as the hepatic flexure, which makes sense because it is on the same side as the liver, which is the right side. And hepatic means pertaining to the liver. And then on this other corner, where it goes from the transverse colon to the descending colon, you have your left hepatic colic flexure. Sorry, not hepatic. Your left colic flexure, which is also known as your splenic flexure, which makes sense because it is right inferior to your spleen, which is a lymphatic accessory organ, which deals with breaking down red blood cells. So that is your digestive system on models.